9:39 exactly. Welcome back. This is News and Views on Salam Media, and we're now going to be talking to Claire Waterhouse, one of those very amazing, hardworking people who truly dedicate their hearts and souls to the type of work and the organization they're involved in, and that, of course, is Doctors Without Borders. And a deep respect to you, Claire, and all of your colleagues. A very good morning to you. Welcome to the program.
Thanks so much for having us.
Lovely to have you here. So, Doctors Without Borders, or the French terminology MSF, we are here to discuss the situation on the ban on MSF operating in Gaza. In human terms, what does this really mean for the patients, the countless of patients who rely on your doctors and hospitals on a daily basis?
Yeah, it's absolutely devastating for the people in the occupied Palestinian territories. We have been present in Gaza and in the West Bank since 1988. So a long time now. We've never had this level of problems, but there's also never been this much need before. So we provide, for example, last year, 1 in 3 births in Gaza was done at an MSF facility or by one of our staff members. We did more than 800,000 outpatient consults last year. We did more than 22,000 surgeries. We've been providing really a full slate of healthcare, particularly through the genocide. And so being banned now, particularly after being banned, we were put in an impossible position, essentially. It's just a pretext to obstruct humanitarian assistance, to continue to hurt the Palestinian people, and it will be absolutely devastating to healthcare in Gaza and in the West Bank. It will cost lives. There's no doubt about it.
So, Claire, you are the MSF South Africa Director of Advocacy and Analysis. So congrats for the amazing work you guys are involved in, not only in Gaza, Palestine, but all around the world, wherever there is strife, wars, natural disasters, etc. And I salute one and all at your organization. But the atrocities, the ongoing atrocities still carry on despite all of or most of the hospitals that have been bombed to probably smithereens, and your staff, the people of MSF, still continue doing this I wouldn't say thankless, but doing this work in very dangerous conditions for themselves, putting their own lives at risk.
Yeah, absolutely. Our staff we have about 1,000 staff in Gaza across the various hospitals that we support, across the health centers that we've set up, all of those kinds of things. And honestly, they are nothing short of heroes. They continue to come to work. Many of them have lost so many members of family. They've lost their homes, their children. They are struggling with the emotional toll of what's happening, the mental health toll of what's happening, high levels of trauma. And of course, we have had colleagues who've been killed as well throughout this horrific situation. So it's really difficult to do the work, and they show up day after day. But that's exactly why I think, this has been a really difficult choice for us, because essentially the Israeli authorities said to us, you have to give us a list of your staff members by the 31st of December, otherwise we will ban you. And we took some time to think about it. We consulted with our Palestinian staff, because it is an impossible choice. By not giving the list, we risk being banned, which has now happened, but we'd protect our staff. By giving the list, of course, we would endanger our amazing staff, and we have absolutely no interest in doing that. And we were unable to get any kind of assurance from the Israeli authorities that if we did hand over some kind of a limited list with people who had consented to their names being on the list, etc., that they would allow us our operational independence, that they would not interfere in our human resources, that they would not, prejudice the names on the list that we give them. We couldn't get those assurances, so we were forced to say, well, then we are not going to be giving you a list, because we can't trust you with a list at this point. We're still open to engage with them, but at this stage, they're not coming to the table. And now that means that last night they announced that we are going to officially be banned and removed from Gaza and the West Bank, which is horrific in humanitarian terms.
So, Claire, we do know that vulnerable groups like children, pregnant women, and the elderly are at high risk once they push you out. But are there any interventions at this stage that can be put in place to prevent MSF from, from your volunteers and workers, healthcare workers, from being shut down?
Mm.
Because really, this is now that they're saying you're shut down, we're talking about a death sentence on those people. That's what we're literally talking about.
Exactly. And that's why it's an absolutely shameful and tragic decision. And, what we need is we need these governments who are being silent to say something and to add pressure. Across Europe, across the Middle East, we are seeing governments that say they support us, that say that they, support the Palestinian people, say they're against the genocide. But when it comes to things like this, we're not seeing that happening. We need these countries and we need these governments, we need these institutions, we need ordinary people like you and I to be standing up and saying, absolutely not. So much has already been taken from the Palestinian people. And as you rightly identified, wounded people, women, children, babies, they are going to be the most vulnerable. We are also seeing terrible weather still in Gaza. People are cold, they're in tents that barely function. There's no clean water. MSF is, we're doing healthcare, but we're also providing 700 million liters of water to the people, per month. So, and that links closely with health. Once there's no clean water, there will be much more sickness. We'll be very worried about things like cholera and those kinds of things. So we are looking at every single possible option to try to prevent this from happening, but we are not people are not negotiating with us. The Israeli authorities are not negotiating with us in good faith, and it makes it's honestly like being caught in between a rock and a hard place, because we have to protect our staff, we have to protect the people who've worked so hard and given up so much for us, but we also have to prioritize our patients. And now, as a result of that horrific choice, where there was no winning for us really, and I think that was ultimately the aim,
Absolutely.
is that we're being pushed out. So we will be looking at any possible way that we can try to continue providing some kind of care, but it's extremely difficult in the circumstances that have been given to us at the moment. And it's not just us impacted by these new regulations that they're doing. There's 37 other NGOs that are also trying to make the same decisions right now and are struggling. And I think we can all see that if 38 of us are kicked out, there will be nothing for Gazans. There will be absolutely nothing. And that, it's just continued genocide. It's just continuing.
Absolutely. Absolutely. A death sentence on the people of Gaza. From MSF's experience on the ground, Claire, how strained is Gaza's healthcare system currently? And once MSF and the other organizations that you allude to, the 37 other organizations, what is that situation going to look like?
It's already catastrophic. So it will be nothing short of even more catastrophic. People don't have access to food. They don't have access to shelter. They don't have access to clean water. All of those things from a healthcare perspective are disastrous to begin with. And then if they cannot access healthcare facilities with qualified people and, like some level of cleanliness and people who can perform the surgeries that they need and the equipment, there's plenty of qualified doctors in Gaza who are doing their best. They work with us, they work with others. But if we can't get medicines in, we can't get supplies in, we can't get, equipment for basic things, if people will suffer. And there's absolutely, we're very worried about pregnant women. We're very worried about newborns. We're worried about people who have wounds already, which is so many people who need, infection prevention. They need new dressings every day. They need, these kinds of things. We're also super worried about the mental health of the people in Gaza, because not only are they a highly traumatized population at the moment, and we're doing our best to provide mental health support, but being left by these organizations, we know that they will just feel even more alone and even more, it's devastating. So yeah, I don't really know what more I can say than that, but this sentence, as you said, this is a death sentence.
And I can hear just how torn and distressed you are about the situation. I just hope and pray that some sort of miracle can happen. But in closing, then, Claire, what is your message? Because surely someone, somewhere, somehow, can and should be intervening and making a decision and making Israel understand just what they're doing is not on, and make them realize that healthcare is needed in Gaza and the rest of Palestine. What would your message be to the international community about the moral? Because Israelis think they are, on the high moral ground, moral and humanitarian consequences of restricting medical aid in an active genocidal zone. All I say is, please, God, have mercy and let a miracle happen. Your thoughts, Claire?
Absolutely. That is what we need. We need, as I said, these countries need to wake up and they need to realize that actually at this point, we're at the edge of a precipice that is something very big. If countries can just get rid of humanitarian actors, then where do we go from there? Who's to say that tomorrow another country doesn't see what has happened to us in Israel and says, oh, well, we can get rid of them too. And, all of us NGOs who are there, we fill two functions. We support Palestinian people, but we are also there to bear witness to what is happening. So by us leaving, there's also just so many less chances for people to see what is happening and for us to share that with the world. So I dread to think what will happen when we are not there in terms of witnessing and bearing witness to what's happening. So really, it is up to people with influence. It is up to these governments, traditional allies of Israel, Germany, the UK, the US. I mean, we need them to stand up and say, actually, no, humanitarianism is important. Gazans and West Bank people deserve healthcare. They deserve to have humanitarian NGOs there, and enough is enough. This cannot be. How much more can we trample on the principles of humanitarianism as we navigate this genocide? So anyone who has an influence needs to stand up now. It's now or never, really. This is really the edge of something that will affect so much more than just the Palestinian people. But at the moment, the Palestinian people are literally our biggest concern.
And you kind of wonder what has happened to humanity all around the world. I mean, we're humans, for goodness sake. How can we see other people suffer and suffer the way they do? But gosh, Claire, Waterhouse, you and MSF not only in South Africa, but all around the world, we salute you for the type of work you're involved in. And thank goodness for people like yourselves. You give us hope that things can turn and will turn. I just want to share two messages on Facebook from Abdul Razak Ismailov. I know he lives in Estonia, in one of the Eastern Europe. And he says, as expected, there isn't a single condemnation from any of the West or the, in inverted commas, axis of Satan. And the next message is, some countries like my own government is even praising this decision. Can you believe just how sick that in fact is? In closing, what would you like to share with us, Claire Waterhouse?
Just to say a big thank you to you for giving us this platform, for always listening to us, and to all of your listeners. We really appreciate it, all the support that we get. And please keep speaking up about this. Please keep drawing people's attention to this. Don't believe the misinformation. There's a lot that's being done to smear MSF's name at the moment. It's not true. We are just here to support the Palestinian people and people all over the world who need help. Thank you so much for listening to us. We appreciate it. And we honestly just hope for a decent outcome for the Palestinian people at this point.
Please, God, yes. That, of course, is Claire Waterhouse, MSF South African Director of Advocacy and Analysis. God bless one in all of you. You're doing sterling work. And if it wasn't for MSF, I kind of wonder what would be happening regarding relief and support work all around the world. Long life to one and all. Thank you indeed. Continue the amazing work. God bless.
Thank you so much.
It is exactly 9:54 and we still have one more interview lined up. We'll talk to that person in a minute or two, but in the meanwhile, I do think we need to take some news from the marketplace.